I'm gonna be showing you the true underlying cause of type 2 diabetes. You see, most people believe that type 2 diabetes is a blood sugar problem. Unfortunately, it really has nothing to do with your blood sugars at all, except the symptom that it creates is elevated blood sugars. So what is type 2 diabetes and why do individuals tend to get worse with time and not get better? So when we look at this chart here, we have a couple different things. We have our cell, we have in blue here, we have the depiction of sugar, and in black right here, we have a depiction of your insulin. Now the goal is to get this sugar into your cell. You see, sugar is our fuel source, right? If we take the example of your car and you have to put gas into the gas tank of your car, if your gas never reaches your engine, you got a big problem. But if you think about the car, to get to the gas from the gas tank to the engine, we have a fuel line. Well, in our body, that is our bloodstream. Our gas tank is our gastrointestinal. So when you consume food, it doesn't matter if you're eating a cookie, a piece of steak, or broccoli, all of that food turns to sugar or glucose in our intestinal tract, and then it releases it into our bloodstream. Now the goal is to get this sugar into your cells because your cells are your engines. Just like your car, the goal is to get the gas from the gas line to the engine so your car can go. This is no different. Now, the way that this works is we have a little door inside your cell. Now, unfortunately, this door is locked and it requires a certain key to open that door. So that key is called insulin. So what insulin does is it comes down and it unlocks that door that then allows the sugar to come into the cell, which now you're able to create energy. You see, inside our cells, we have multiple engines, and the goal is to get the sugars into that cell so you can create energy, and this is how we function. Wonder why so many type 2 diabetics have low energy, low brain function, they don't feel good, they're tired all the time, they don't sleep well? This is the reason why, because when you have multiple cells in your body that can't accept the sugar, you start to feel tired all the time, and that's why it happens, why your metabolism decreases, you start gaining weight, etc. All the spiraling effects of type 2 diabetes. So the question is this is the normal functioning, right? If we take another cell here, we take the same situation. The difference is in this scenario, what happens is the insulin comes down, but the door doesn't unlock. Is it not unlocking because it just doesn't have the right key? No, it's not unlocking because something has blocked the ability for that key to open the door. Imagine going up to your door and there was no key lock. There was nothing to unlock the door. This is no different. You can't get in your house. So this happens inside of our body as well. So now, as the sugar's coming down, if that door doesn't open, where does that sugar go? It goes right back up in your bloodstream, which now we start to increase sugar throughout our bloodstream. So the reason why we have increased sugars is not because of what you're eating. It's not because of your inability to lose weight or lack of exercise. It's because you have many cells that are damaged. This is not because of one or two cells. Remember, we have trillions of cells in our body. This requires a high percentage. That's why many diabetics, you may not realize this, but when you get diagnosed with diabetes, that's not when it started. This process of these cells being damaged takes decades. It requires a certain percentage, and some people it could be 10% of your cells that are damaged, another one could be 15%, etc., etc. But when you hit that threshold where enough cells are damaged, you start to increase your sugars in your bloodstream. And then what happens? You go see your doctor, and what do they tell you? Oh, you have type 2 diabetes, start changing your diet, exercise, losing weight, take some medication as well. Now, initially when this starts to occur, guess what happens to your sugars? They start to go down. Why are they going down? Because you're starting to change your lifestyle. In the early stages of diabetes, changing your lifestyle can start to make things look better. Your blood sugars will go down. Your medication is forcing your sugars to come down. All of these things are happening, but what happens over time? What happens over time is whatever this problem is that's going on, and by the way, this will be happening to multiple cells, whatever this is will continue. And so the next thing you know, now you've got 20% of your cells damaged. So now the same things you were doing before, like your exercise, your weight training, or whatever it is you were doing, changing your diet, taking specific medications, no longer works. And what happens? These sugars start to go back up again. Now, when you go see your doctor, what do they tell you? Oh, we need to increase your dosages. We have to increase your medication. And the reason why this is happening is not because not eating right or your body's not working for you. It's because this problem, whatever this is now affecting multiple other cells. And the longer this problem stays inside your body, the more cells that become damaged. The more cells that become damaged, the sicker you become. Think about this. What area in your body is not made of cells? There's nothing. They're all made of cells. So this is the reason why you have a disease process, type 2 diabetes, that can impact any tissues in your body. Why one person could have vision loss, the next one could have brain problems like dementia or Alzheimer's, the next one cardiovascular issues, the next one kidney, liver, the next one can be circulation. You could have neuropathies that can cause amputations. So think about this. There's not many diseases, if really any, that from one disease can impact so many different areas of your body. This is why diabetes is so scary, especially in the early stages, because many people feel good. But if you want to learn more about what we do in our office, make sure you click that link below, because I've created a guide for you to start giving you information about what you should start doing now to start reversing and affecting your diabetes. If nothing else, start lowering those sugars. So what is really going on? What kind of problems do we typically identify that could be contributing to this cell damage, the inability for you to unlock that door with insulin? What I want you to understand is that this is not a lack of insulin problem, right? The amount of insulin in most type 2 diabetics is still there. It's not the signal, it's the inability for that signal to do its job, right? Imagine if you were talking to somebody on your phone and you got away from a cell phone tower. You're gonna lose that signal. Your phone still works, you're just not receiving that signal. This is no different. So what are some of these potential problems that can happen? We see things like inflammation. This is a common scenario that can create this problem, because remember, inflammation is fire, right? And it can burn and destroy those areas in the cells. We can see things like toxins, very common problems. They just block all through the cell here, causing multiple damage and debris, and the inability for the doors to be unlocked from insulin sources. We can see things like infection patterns, right? Infections can start to develop over time and start damaging your cells, especially chronic infections, viral infections, bacterial infections, etc. We can see problems with specific organs, like the liver. I mean, the liver is massively important for blood sugar regulation. If your liver is not working well, that's a problem. Other organs that are involved, kidney function, thyroid. I mean, almost every single organ and tissue in your body and system in some capacity is helping to support blood sugar. Because why? Because remember, it's our fuel source. This is how we function as human beings. If you can't get this sugar into your cells, you are slowly dying. And again, this is why they call diabetes the silent killer, because many people in the early stages, when you only have, say, 10 to 15% of the cells that are damaged, you're not going to notice it. You're going to say, I feel fine, I'm good to go. But what happens when 20%, 30%, 40%, etc. happens? You get sicker with time. So don't wait on this disease process, because I'm telling you, they call it a progressive disease process for a reason. It will get worse with time no matter what you do, unless you identify what this problem is for you. The good news is there is lots of diagnostic testing, easy tests that can be ran to identify what these problems are to create that customized solution. If you want to learn more about those diagnostic tests and the solutions that we do, make sure you watch this video, because in this video I go into more details specifically of what we do in our practice to help patients actually reverse their diabetes, get off medications, lower blood sugars, and have a normal A1C. Imagine that again, being able to be in a place where you no longer have diabetes or no diagnosis of it. That's a possibility. Make sure you watch next time. Take care.